Thank you so much for joining us for our coffee conversations this morning with Forge Breast Cancer Survivor Center. I'm Janita, and I am here with Beth Chandler this morning. Super, super excited to be having another coffee conversation with her. I missed the first one by a hair a couple years ago, so we're really happy to be working with her again in another format because she already does so much coverage. So, Beth, for those who are unfamiliar with all that you do, could you please introduce yourself?
Sure. Thank you, Janita, for having me, and welcome all of the Forge family. My name is Beth Chandler. I am a physical therapist. I'm from Birmingham, Alabama. I grew up here. I went to the University of Alabama for undergraduate, studied psychology and dance there, and then attended physical therapy school at UAB, and have been practicing physical therapy for 32 years. Long time. I guess that ages me a bit. But I love what I do. It's the only reason I still work. I spent the majority of that time doing acute care, some outpatient, and some inpatient rehab until 2019. I got certified to do lymphedema. So I am a certified lymphedema therapist. And then started the program at Grandview Medical Center, where I've been a physical therapist for the past, this is my 20th year at Grandview. And have been doing predominantly lymphedema therapy management since 2020. And now I'm doing 100% lymphedema. And also, and I opened the program because of my passion for cancer patients. When we opened our cancer center at Grandview, they were in need of having a lymphedema therapist on staff. And I like to say I got tapped by God on the shoulder because I wasn't really looking to change career paths at that point. I loved working in the hospital with the multidisciplinary team that you get in the hospital. So once I changed career paths and got certified to do lymphedema, I've been blessed. I've been accepted by the cancer community, and I'm so happy to be involved with Forge. I got involved with them, I believe, during the pandemic, 2020, sometime during that time frame, and did my first coffee chat on lymphedema in, I believe it was 2021. And I do serve on the Forge Clinical Advisory Board, and I do a lot with our cancer center at Grandview. I work in our outpatient rehab center there on campus at Grandview. I'm married. My husband is a CPA, and we have one son, and he's 25, and he's a civil engineer. So we're real proud of him. That probably sums up my career path, but
Yeah, I was going to say y'all are a house of smart people. Thank goodness. Thank
for
you so
all
much
different
for
pathways.
yeah. And I'm so glad that you have a passion for it because that makes such a difference in the services that people can receive when you care so much about it and you're willing to find new and creative ways, or just to address the needs. We really appreciate you and your presence in this field. So when we're talking about today's coffee conversation, so range of motion and cording, what are some common limitations that breast cancer patients can experience during and after treatment? And can you kind of tell us a little bit about like what is cording? What does that mean? And how is it related to someone treating for breast cancer, getting treated for breast cancer?
Okay, well, I'll start the beginning of that question with just dealing with range of motion limitations. And then I'll discuss how cording can be involved with those restrictions. Some people can have range of motion limitations, specifically in shoulder, elbow, after having surgery. Often there are surgical precautions and limitations initially, and people are worried about disrupting their surgical healing and don't want to move. So sometimes there can be restrictions in the shoulder, elbow, specifically because of post-op changes, regardless of the type of surgery, whether it's a full mastectomy, partial mastectomy, lumpectomy, lymph node dissection, there can be just some soft tissue range of motion limitations. Also scarring, depending on where the scars are, whether in the armpit, the axilla, across the breast, or if patients have had reconstructive surgery, there may be some plastic surgical limitations after having reconstructive surgery that limit one or both shoulders. I have had patients that had both shoulders limited because they had post-op precautions and then were worried about actually resuming their physical activity. Another common issue is after radiation, having some radiation changes in the skin, in the scars. It can affect the scarring and create some stiffness in the skin, and there can be range of motion limitations because of that. There can also be neck, you can have neck limitations anywhere in that upper quadrant or bilateral upper quadrants. There can be restrictions because of people not being told when and how to move after surgery. Cording or axillary web syndrome, you can hear it called lymphatic cording, can occur after lymph nodes are removed. And what they think happens is after lymph nodes are removed, those nodes, the vessels that were attached to the nodes, they're tiny vessels attached to the actual lymph node. When the nodes are removed, those tiny lymph vessels can be dangling out there, and then the connective tissue, the fascia, the repair of healing can create a cording, which is like a rope-like stringy looking under the armpit or even down the arm. And a lot of that is because of fascial changes, your fascial tissues, the connective tissues in the lymph structures. And that can be anywhere leading from the breast all the way down the arm. Just checking my notes to see if there was anything else.
No, you're fine. So that's a lot of information. But
sorry, I might go into too much information. But
no, but I like that you broke it down, because like people like me, I didn't know prior to working in breast cancer, just all of the other different side effects and how they kind of come about and how treatment can impact simple things that you think are simple, but actually they can become more complex as you go throughout your treatment journey. And especially when it comes to range of motion, like literally moving your arms and your neck and all of those different things. There are so many components that accompany the treatment that someone might get. And so I love that you broke it down. Please don't apologize for that. It's all very good information. And so can you kind of tell us about, when it comes to range of motion, why is it so important for, or what is the importance of a person making sure that they're exercising to improve their range of motion? Is this something that just gets better eventually, or is it something that they have to continue to work on?
Well, to start with sort of the diagnostic phase and going through treatment, I can't stress enough the importance of exercise during your treatment, diagnostics, and post-op. And by exercise, I mean, if you've been exercising regularly, when you are diagnosed, don't feel like you need to stop that unless that's, was a specific direction from your oncologist. Exercise, just general exercise, can help you maintain energy level as you're going through treatment. Specifically, if you're going through radiation and chemo, those can be things that bring on a lot of fatigue and low energy level. And that regular exercise, even though you might not feel like it, just going for a walk before you go to treatment. Now, after, you may want to rest, but before you go to a chemo treatment or a radiation treatment, getting in some light exercise can really help you sort of get through that, recover from that. And then once you've had surgery or after your completed treatment, early intervention as far as range of motion is beginning early range of motion of the shoulder, elbow, even into the hand and wrist. Now, we do have to be mindful of your surgical precautions so as not to disrupt anything from a surgical standpoint, but that still means you can move your hand and your wrist and your elbow so that you're keeping fluid moving through the arm and the upper quadrant. And that can help you prevent some of those things like lymphedema and surgical contractures, range of motion deficits, and cording. And another thing with regard to radiation is making sure that you're keeping, once your surgeon has approved, making sure that you're keeping your range of motion, because any of you who have been through radiation know that this is pretty much how you have to get, whether it's face up, face down. And if you're limited in range of motion in your shoulder and elbows, then that's going to be a challenge. I have had surgeons and radiation oncologists send send me patients before radiation because they're not able to get into that position. So that can be real important before and during radiation to maintain that shoulder motion.
So how does physical therapy help someone when they are having some range of motion restrictions?
Well, when someone's referred to physical therapy after breast cancer, and for us, it doesn't matter really what, I mean, it matters for me what type of treatments you've had, but we're going to evaluate what your current deficits are. And then keep in mind whether you've had radiation, chemo, and what type of surgery you've had. We're going to evaluate for specific limitations in the joints, for specific issues in the skin and soft tissues, such as scarring, fibrosis, skin changes from radiation, and then help develop an individualized exercise program for you and teach you how to do some of these things on your own, whether it's an exercise program, stretching, or even working on your own scar and skin issues, some techniques to help teach you how to manage it on your own. As far as the types of therapy, there are manual techniques that I'll go through in a bit, such as hands-on techniques. We'll do some active and passive motion with you so that we see what your limitations and tolerance are. We'll do some soft tissue stretching and myofascial techniques, and then teach you how to do some of those things on your own. Then we can guide you through that. And sometimes there's even postural deficits, such as strength deficits in the upper body, that we can address to help get those shoulders back, that chest opened up, and strengthen that upper back that might have gotten weak during your treatments.
So when someone is like interested in physical therapy or doing physical therapy, how are they able to collaborate with the other individuals on their care team, such as their oncologist and their surgeon? How important is that, and how does someone kind of start to begin that conversation with their care team?
From a patient perspective, if you have concerns such as pain, feeling of tightness, feeling of heaviness, not able to move your arm like you were before surgery, have that conversation with any of your care team. Oncologist, we get referrals from oncologists, from the breast surgeons, from the radiation oncologist. And so we can get a referral from any of those. It's our responsibility as therapists, if we have any concerns, such as tissue changes that might be a surgical, issue, lumps, bumps, fluid accumulation that might be some sort of seroma. And then if we are concerned about any surgical, if it's early after surgery and we're concerned about any surgical complications, not complications, surgical precautions, then we would consult with those physicians. Just last week, I got a referral. Actually, it was from a cardiologist who specializes with breast cancer, who sent me a referral, but I had questions for the oncologist. So I reached out to the oncologist and got their most recent clinic notes and scans so that I could incorporate that into my treatment plan. If there are issues during our therapies with a particular finding inside the therapy clinic, I'll either reach out myself or ask the patient, when you go see your doctor next time, ask them this or discuss this with them. And that can even go beyond the oncology team. If there's some other medical issue and a patient has a cardiologist or has a nephrologist, often there's times we might reach out to them or have the patient discuss whatever that issue is with them. And then within the therapy world, I have a great team of therapists around me. I do 100% lymphedema, and then treat any of my breast cancer patient other issues such as range of motion limitation and soft tissue throughout my treatment. If I have a specific problem that I feel like is outside my scope, then I'm going to consult with other therapists around me. I have a couple of other therapists and PT assistants that help me with my breast cancer population. So if they need to be, treated with more aggressive soft tissue issues, as well as lymphedema, or if there's any specific things that, such as dry needling or things that I don't do, then I will consult with other PTs or OTs in my clinic.
Awesome. Thank you so much. So Once somebody has completed their treatment, what are some things that you have noticed that is a barrier for someone when they're trying to achieve optimal range of motion post treatment, whether that's, their radiation or whatever?
Yeah, so I want to say one of my passions for the cancer population um, has always been, even in my young stage of practice, that the cancer population tends to be super motivated, super uplifting and positive. And when it comes to therapies, uh, I get a lot of great outcomes because patients are very compliant. They want to do the best that they can do. So I have very few barriers to meeting goals and outcomes. As you mentioned with radiation, often that can be a limitation. I wouldn't say a full barrier because we do expect some changes during radiation. And if I'm treating a patient as they're going through radiation, if we see skin changes or skin openings, cracks in the skin, anything like that, then we kind of hold back on stretching and myofascial techniques because you don't want to put hands on fragile tissue, nor do you want to stretch if there's already skin breakdown. That just delays our treatment a little bit. So often we'll take a little break, or we'll deal with other issues and other problems during that time. And then once the skin heals, then we're back to being able to stretch and mobilize the tissues. The only other tiny other barrier I would say is people's schedule. If I have patients that are undergoing chemo treatments 2-3 times a week, if they're doing daily radiation, then I just try to work with them on their schedule. And it's okay if we prolong therapy a little bit. They need to do their medical treatments and their radiation treatments, and we can just extend their treatment plan for therapies.
So, what are some specific therapy techniques or modalities that you find particularly useful and beneficial when addressing range of motion and cording?
Yeah, so I touched on a few of those things earlier.
Mhm.
Some of the hands-on things that we do in the therapy world are a technique called myofascial release, and that's a hands-on treatment that can stretch tissues, that can really help stretch, and that's for cording, it's for joint limitations, soft tissue limitations, even post-radiation changes on the healed skin, of course. There's passive techniques such as passive stretching and passive range of motion. And then we start teaching you how to do those techniques on your own. There's some specific techniques for any cording issues. There are hands-on techniques, and again, we teach you how to do that. There are also specific techniques for scar mobilization. Some with our hands, some with some gentle tools that we can also again teach you how to do. There are forms of kinesiotaping that can be used for swelling, for stretching, for postural stabilization, and that's the tape that you see the Olympic athletes have strapped all over their body that's different
Mhm.
colors. Ours is a boring black, but it works. And that's just another modality. If there's any muscular tension issues in other parts, not the quadrant, but say neck or lower back, there is some dry needling. I've used that on several patients. If someone is at risk for lymphedema, we don't dry needle in that quadrant, such as in the chest or arm, but we can do that up along the spine in the thoracic and cervical region. I'm not licensed to do dry needling, but we have several therapists in our clinic who do, and one of those therapists does help me a lot with my breast cancer population. Then there's another modality that's a compression device, and then there's other additional lymphedema type therapies such as compression garments that I won't go into today. But if you have had issues with swelling, with seromas, with fibrotic changes after radiation, then there's a compression device that can help with that. I think that's all I had on my notes. There's other modalities that you guys might have heard of, such as electrical stimulation, ultrasound, deep heat techniques. We don't do those after cancer treatments in the area of the cancer. Now, if you had other issues such as a hip problem or a low back problem, that can be fine, but it is a contraindication in the field of the body that's had cancer because it can proliferate anything that's deep down in there at the cellular level. We don't want to do anything to proliferate any potential cancer cells.
Thank you so much, Beth. Do you have any final thoughts that you'd like to leave everyone with? This has just been such good information because I mean, I know that I've learned a lot, and I'm sure this will be really helpful for someone as they're preparing for their treatment and kind of if they see these things pop up, well, they can reference to know, hey, like this is something that I've noticed and let me bring it up to my care team and explore options. So what are some final thoughts you'd like to leave our viewers and listeners with?
Yeah, so if at any point, and even before, don't if you've been diagnosed and are just now starting your journey, don't be afraid if you already have limitations in your upper body, to go ahead and seek out some physical therapy. You can still get, you don't have to have been through surgery and cancer treatments to qualify for therapy. If you have joint pain, range of motion restrictions in your shoulders or neck before you've had surgery, and we do see patients preoperatively, and they can qualify if they have pain and joint limitations or weaknesses that we might could go ahead and start addressing before your journey. And then again, as Janita said, if you start noticing any issues with your body and changes with your body that are limiting your everyday activity, then seek out, discuss with your care team. They can decide when and how, to refer to a therapist for range of motion, for lymphedema, for soft tissue restrictions, or for pain. A lot of you can have neuropathy pain, so that can be another issue after having specific types of chemo. And then if you have any questions about whether or not you need therapy, you can discuss that with your Forge team. They can say, "Oh, here's Beth's email. Reach out to her," or refer you back to your surgeon, because we're all working together to help you through your journey. And there's a lot of people that can direct you on who you need to discuss certain issues with if you're having problems with your body. And my final thing is, don't be afraid to move. If you have precautions, your surgeon is going to tell you that. Otherwise, you need to be actively moving after surgery. When you're putting up dishes, folding clothes, filling up your bird feeders, whatever your hobbies are, use your body to do that. Don't be afraid to move, because you will be told if you have restrictions. And if you don't have restrictions, then by all means start working those arms and upper body.
Well, thank you so much, Beth. It's such a pleasure to have you this morning. And thank you so much for lending your expertise to talk about this, because it is so important for people to, know about the side effects of treatment, but also that there are resources available to assist them as they navigate through it. And so we're very grateful and thank you so much.
Absolutely. Glad to be here. Honored to be a part of your journeys.